Ontario is, part of the campaign election platform by the PCs, and the leader, Doug Ford, who's now premier, won a supermajority again for a second term. Well, they're talking about healthcare and what's needed in healthcare, and with the backlogs, surgical backlogs to be exact, as that was created during COVID in the last 2.5 years. Now, the government is saying that they potentially want to take a harder line when it comes to the province clearing up the hospital beds that are needed for emergency room and to be able to clear those surgical backlogs. And with what they're predicting ahead with the flu season, as we know, come September, October, that's when, sometimes the COVID cases go up. Well, that's what we've seen in the trend in the last 2.5 years, but also when it's just flu season. And so this is at a time where this is now a discussion at Queen's Park. We're going to take you to the clip, but just to lay out the scene, essentially this issue is about elderly people in the hospital, and when they are cleared and no longer need to stay at the hospital and they're to be discharged, to be taken to potentially a long-term care home. Well, in the cases, or what you'd call a nursing home, in cases where the elderly person, a senior person, doesn't want to leave the hospital bed, well, this is an issue that potentially the hospital could start billing them about $62 a day if they refuse to leave. Now, hospitals have had this ability to do this since 1979 under the previous PC government, and whether they have used this ability to do so, that's right now unclear. But this was an issue that was brought up yesterday at Queen's Park with the NDP interim leader, Peter Tabuns, who asks the PC government, and Paul Calandra, a PC MPP, answers the question. Take a look.
Supplementary question.
Doesn't seem to mention billing. No. There are cases of this government and the Liberals before it attempting to bill seniors for their hospital beds. A 2010 report from the Advocacy Centre for the Elderly, written by lawyer Jane Metis, says seniors have been threatened with a daily hospital bill for, I quote, the non-OHIP daily rate, which ranges anywhere from $500 to $1,500 or more per day, end quote. Can the minister guarantee right now that if a senior refuses to go to a care home they don't want, they will never be billed for their hospital bed?
Minister of Long-Term Care.
I assume that the minister or the member must be talking about a regulation that was put in place in 1979 in this place, Mr. Speaker, that has been on the books since 1979. I can confirm absolutely 100% that nowhere in the bill that I have introduced does it suggest that seniors will be A, moved from a long-term care, from a hospital without their consent, or B, will be charged.
The final supplementary.
Speaker, again to the minister, the government's plan for healthcare seems to involve Ontarians opening their wallets. The minister has not ruled out fragile seniors and their families racking up thousands of dollars in a bill for a hospital stay. And the Ford government has a plan for more privatized surgeries and procedures which always result in extra charges. Why does this government believe it's okay for healthcare to come with a bill?
The minister.
Yeah, Mr. Speaker, I'm not sure what the member is reading. So at some point in time, when you get the answer to your question on the first question, you might want to modify your second and third question, Mr. Speaker. So I'll give it to the member opposite. As I said yesterday, I can appreciate that they didn't read the bill when they had the opportunity Thursday, Friday, Saturday, Sunday, Monday, or even this morning. I can appreciate that he wasn't here.
There you have it. That was what happened at Queen's Park. Now, the legislation known as Bill 7 would allow for elderly or chronic patients that no longer require acute hospital care to be moved into the nursing home if the doctor says that they're ready to be discharged. Now the issue remains about whether they'll be billed if they require to stay, as Calandra, MPP Calandra, PC MPP Calandra has said that they will not be billed, but it's important to take a look at the legislation because this is an issue that's been risen. Now the government is hoping to free up 2,500 hospital beds, and they're expecting that there will be a winter surge when it comes to long-term care providers And they've also warned that their homes are facing worse staffing shortages than hospitals. So as the elderly are moved to a long-term care facility, and if there's staffing shortages, well, that's going to be problematic as well. As we also know, there's also a crisis when it comes to staffing for nurses. It's a massive issue, and this is going to be one of the biggest agendas for this government, who won a supermajority, to be able to tackle.